The record. My name is Jonathan Jones. It is my pleasure and my privilege to be your host and moderator for this afternoon. And once again, if you have folks that you believe could benefit from a presentation like this or from being here today and learning about diabetes and potential ways of being able to deal with diabetes. In fact, what we're sharing with you is information from Dr. Prasad's own newly published paper on diabetes. This man didn't just say, okay, there's something that's nice for diabetes. He went through the whole scientific process and wrote down exactly what was necessary. And a nationally, worldwide publishing organization saw fit to publish it. So it is part of the official library of documents, official documents available to the scientific community with research that you're going to be hearing today. So consider yourselves to be part of an elite group of people who have access to this kind of information. So what can we say about diabetes? Well, before we get into all the disclaimers and all that, just note this. And I went to search and see if there was any new information. It hasn't been updated yet. The CDC has not provided us with much different information than what we're seeing right here. But as far as the incidence is concerned, we're talking 1.4 million newly diagnosed cases among 18 years and older. So we're looking at 187,000 cases of type 1 diabetes. That's the incidence rate. 6.6 per thousand in men and 5.2 per thousand in women. So as far as the prevalence is concerned, I did see one figure that has taken this 37.3 million number up to 38.1. So there has been a significant increase, and that's as of 2021. So the number is very high. Pre-diabetics, not much different. There's still about 96 million of those out there, and about 1.6, 1.7 million with type 1. The point of this is, out of all the people with diabetes, listen carefully, 95% have type 2 diabetes. 5% have type 1. Dr. Prasad is going to make comment on that a little bit later on. And think in terms of the cost. Think in terms of the cost of this, I'm going to call it an industry. But this industry, this disease, is responsible for the movement of $403 billion in revenue every single year. That's the cost of treating diabetes. That's a huge impact to the medical community and a huge impact to you and I. Lost productivity and all kinds of other things. Type 1 diabetes falls into the category where the pancreas just is not doing anything. The beta receptors or beta cells on the pancreas have been attacked, and they're not able to produce insulin, not able to detect that there's sugar in the bloodstream and not able to produce the insulin that's needed to make sure that the sugar can penetrate into cells. Type 2 diabetes, that can happen at any time. Person can become insulin resistant. And Dr. Prasad has kind of made it clear to us over the years that this really truly is precipitated by oxidative stress. And so he'll explain and break down a lot of it to make it a little bit easier for all of us to understand. So we can look forward to hearing those comments here in just a few moments. So to make sure that everything remains on the up and up, because by law, we're not allowed to give you the impression that a nutritional supplement will cure, treat, or heal any disease in any way, shape, or form. So we have to tell you this, all right? So the FDA has not evaluated these statements. Testimonials that you'll hear are purely anecdotal. Results are atypical. And that means that what happens to one person may or may not happen to you. So neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, or any of the authorized representatives are making any claims that supplements, micro daily, and collagen daily, probiotic boost, omega-3 daily, any other supplements that we'll be discussing will treat or cure any disease state. This presentation is not intended to be a substitute for a visit to your primary healthcare physician. We strongly recommend that you seek the competent medical advice of professionals that you trust. This is for education and information purposes only. So our the focal point of our discussion centers around this gentleman here. He's not just Dr. Prasad, he's Professor Prasad. He was professor at University of Colorado School of Medicine for some 30 years, the director of vitamin and cancer research. So if you were going to have someone put together and formulate a supplement, dietary supplement, multivitamin, cocktail for inflammation, a cocktail for whatever, would you prefer that it be someone who just graduated from college, someone who all his life wanted to put together a formula for a dietary supplement, and he's only been alive about 30 years? No. Or would you prefer it was someone who had been teaching at a university, school of medicine, for more than 30 years? This gentleman has forgotten more than most people in that category. No. He was a former president of the International Society of Cancer Nutrition, a member of the Royal Society of Medicine in London, UK, also invited to be a member of the Nobel Peace Prize nominating committee in the candidates of medicine. He was the world's first radiation biology PhD, and his formulas for nutritional supplements have been awarded not 8, but 10 US patents in the category of micronutrients. He's the leader of the pack. So he's like the godfather of micronutrients. One of the things that I'm really proud to be able to pass on to people is that this gentleman was the one who discovered that vitamin E succinate as an anti-cancer component. Vitamin E succinate, it's cytotoxic to cancer. So that means that I think it's six different types of vitamin E. Out of all the scientists on planet Earth, Dr. Prasad is a scientist that figured out that one of those vitamin E's just so happens to kill cancer cells. It's just as good as all the other vitamin E's, but that particular one is cytotoxic to cancer cells. He's the gentleman that is credited with discovering that. Just like Newton discovered gravity, this gentleman is the one who discovered the fact that vitamin E succinate is cytotoxic to cancer cells. He also knows a little bit about the gut. He's the one who discovered that butyric acid, small fatty acid formed by the fermentation of fibers in the gut, is an anti-cancer agent. So he knows a little bit of something about the microbiome and exactly what's needed to be in your body to help it to function right. And by the way, every disease, diabetes included, has a particular signature. It's like it's got a thumbprint that shows up in the gut. And Dr. Prasad has cracked the code. So he knows how to make the thumbprint, the signature in the gut, favorable for someone who's fighting something as serious as diabetes, even cancer for that matter. We're not talking about a cure. We're just talking about how to put the gut in a favorable condition so the body can do what it's designed to do. He's the author or co-author of some 33 books. I think that number is 35 now. And he's been published in more than 250 peer-review publications. So this gentleman truly is world-renowned scientist. This is the paper that the comments that you're about to hear is based on. So you want to take a screenshot of that? You can go ahead and do a search for this and find it. If you can't find it, then I just speak to whoever invited you, whoever's in your legacy upline, and they'll be able to either get in contact with me or Dr. Prasad for an actual copy of this paper. Look at the title: Prevention and Improved Treatment of Diabetes Using Micronutrient Mixture, Probiotics, Omega-3, and Collagen Peptide. That's a paper that was published in the Journal of Nutrition and Food Sciences, peer-reviewed publication. So this is pretty amazing that we're getting cutting-edge information like this from Professor Prasad. And you'll want to make sure that you pay extra attention to this. Take notes. Take notes. You're going to find it to be quite interesting to hear what he has to say about the subject. And toward the end, there will be an interesting testimonial that we'll share as well. And if we have some time, we'll take a few of your questions, or I'm sure that there's some here right now who have diabetes and who no doubt benefited from some of Dr. Prasad's formulas with regard to diabetes. So we'll look forward to that as well. Okay, so let's do this. I'm going to I've already introduced you who Dr. Prasad is, and so my next step is I'm going to take you to the clip of the discussion where Dr. Prasad specifically drills down on diabetes and how his published information makes all the difference in the world and a difference in this dreaded condition. So give me just a second here, and we'll get it right where we need it.
I think that's what folks really want to hear. But go ahead and give us a little bit of this history of diabetes.
Yeah, I did. You mentioned that diabetes had been there for a long time. And even as early as 1550, Egyptian medicalists described the disease as a frequent urination, one of the symptoms of diabetes. Indian Ayurvedic medicine refers to as a honey urine because near the urine, ants used to accumulate there, and that's why they used to diagnose that, yeah, you have a diabetes. In 2nd century, Greek physicians coined the term diabetes, and then later on, English physician added the word mellitus, means sweet or urine. You can see that urine becomes loaded with the sugar, and that's why it is called honey urine, because kidney is not functioning. As you know, there are two types of diabetes. Diabetes 1, which you inherited from the parent, and in this case, the pancreas is totally destroyed, and they can produce insulin. And as you know, insulin is very important for glucose uptake and metabolism. But type 2 diabetes is not inherited. 95% of people who have diabetes, they have diabetes type 2. Only 5% or less has a diabetes type 1. And diabetes type 1 is also can be acquired if you have autoimmune disease, which will destroy the pancreas. So the pancreas can be destroyed by a gene defect. It could be destroyed by autoimmune disease. So type 1, that's why it is so rare. Not rare, but 5% of the population have type 1 diabetes.
I see.
And diabetes 2, of course, most 95% is diabetes. And
that's on the rise right now. This type 2 diabetes
yes,
is exploding.
Yeah, and this diabetes occurs where you have the pancreas is producing insulin sufficient amount.
Mm-hmm.
It can't make the insulin receptor functional, so that glucose cannot enter into the cell and metabolize. So glucose accumulates in your blood because it has no place to go.
I see.
That's why you have developed
some slides that's going to show us that. So we look forward to that.
Yeah. And so this is very important. And so there are many risk factors for the diabetes. You have external risk factor like obesity is one of the most critical risk factor that is in your hand, that you can do something about it. Lack of physical activity, as you know, and that also leads to obesity. Distribution of fat, if you eat too much fatty acid, especially around the stomach. Ethnicity, Black, Latino, Native American are at higher risk of developing diabetes than white Americans, maybe because of the diet.
Right.
Fat, higher sugar consumptions is another factor. Age, and pre-diabetic condition of yours, it will lead to, if you don't do anything, when you are pre-diabetic, it can lead to real diabetes. And of course, family history, that you can't control it. This is beyond your control. But many of the risk factor, you can control it and reduce the risk of diabetes. But
I think
go ahead.
We're programmed though to really like and love sugar, and then hidden it in everything. So it really,
I know,
we're almost
that's the whole thing.
Forced right into diabetes.
Just imagine that the recommended allowance of sugar is about 26 grams of sugar, because certain amount of sugar you must have it. Your brain needs it for energy generation. But if you have a 1 can or bottle of Coke or any kind of soft drinks,
Yeah.
they have a 28 grams. So you are done for the day. If you have 1 time. But do we stop there? No. I'm just giving you that how much sugar consumption. It is amazing how our body can be synthesized until they get tired of. But anyway, and also that don't forget that high sugar also generates oxidative stress.
Right.
So this is very important. So
Right.
family history, you can see that if one parent have diabetes, the children.
And this is for type 1 diabetes?
Type 1 diabetes, yeah,
Okay.
family history. And also it is a injury to pancreas. Suppose somebody hit your pancreas and the pancreas is very, very damaged and can produce insulin, then you can have a type 1 type of diabetes. Type 1 type of diabetes is very important that your pancreas is so much damaged, either by genetics or by some physical injury or by autoimmune disease, then they can produce any insulin.
Well, right there, Dr. Prasad, those last two, this production of autoantibodies, that suggests that today I could become a type 1 diabetic if my immune system goes wacko.
Yeah, if your immune system, yeah. And of course, sometimes exposure to virus can destroy your pancreas and then it can produce insulin.
So you mean this virus that people have been dealing with for the past few years could literally be contributing to type 1 diabetes?
No, it is possible, but until the pancreas is affected. So you can have infection, but pancreas is not affected, then this is okay.
Yeah.
But it is possible that certain type of virus may attack pancreas.
Can do it.
Chance.
A virus can do it. Gotcha. Okay.
Yeah.
Mm-hmm.
Yeah.
Symptoms
That's what I like this picture. Yeah. You can see that increased thirst, frequent urination, like you saw historical events, increased hunger. That means you become more fat, unintended weight loss. That occurs under when you have a very what you call advanced stage of diabetes. Fatigue and blood vision, again, these are very complication of diabetes. Numbness and tingling in the hand and feet. It is also very advanced stage, which is called a diabetic-related complication, which occurs in your eye, in your kidney, and in your peripheral nerve cell. And of course, if you have some kind of a sore, they are difficult to heal, and that's why you have sometimes amputation of the leg.
Right. Gotcha.
You can see that here is the very important thing to remember when you go to the doctor, how they are diagnosed. So
I see. So this, I got you. Go ahead, please. Go ahead. I'm sorry.
No, I mean, you can see that if your blood sugar level, fasting blood sugar is important to remember, 100 milligram or less, then you are okay.
I see.
But if you pre-diabetic, 100 to 125 then you have pre-diabetic level, which can be reversed if you take a proper action. And the thing is that diabetes, of course, is 200 or more. But important thing pre-diabetic is to remember is sometimes older individual, even if you don't have a symptoms of diabetes, they have higher level of sugar.
Mm-hmm.
But still, as soon as you detect, irrespective of age, that you are more towards 125, then you should either cut down sugar very easily. Another thing that we will suggest that can help you to reverse the pre-diabetic level so you never develop diabetes.
Mm-hmm.
And then A1C1 level, A1C is a level of because oxygen binds with the hemoglobin. So it is called A1C. Technically it is called hemoglobin or HbA1c.
Right.
But short A1C level, it reflects that how much oxygen, how much sugar is bound with the hemoglobin. And as you know, hemoglobin is the carrier of oxygen. So if you have too much glucose bound to too many molecules of hemoglobin, your organs, different part of the body may not get a sufficient amount of oxygen, and you may feel tired and sleepy and so on.
Mm-hmm. Mm-hmm.
So it is. So you can hear the incident. This is very important. That the incidence of per year, this is a per year, is 1.4 million
Wow.
newly diagnosed cases, 18 years and older you have, out of which about 187,000 is type 1 diabetes. Incidence of men looks like is higher, 6.6 per thousand, and this is only 5.2 in women per thousand. And total number, this is 2019 data, probably today is more. Total number of people who are living with the actual diagnosis is 37.3 million, you can imagine.
Wow.
And pre-diabetic condition is 96 million. This is 2019. We are now 4 years later. I would say maybe more than 40 million, but data is not available.
Right.
And diabetic condition is 96 million. They can all be reversed. And type 1 diabetes is about 1.6 million. So there are a lot of people with diabetes.
Dr.
And
Prasad,
even-
that's 133 million people.
Yeah. And the thing is that these things, even type 1 diabetes, we can prevent type 1 diabetes because it is autoimmune disease, it is something is genetics, you can't do anything. But we can prevent or we can reduce the rate of the progression of type 1 diabetes, just like we can do the type 2, so that you don't develop a diabetic-related complications. This is very important.
Wow. Wow. That's just mind-numbing.
Yes, the number is not only here in this country, even in India. I think some of is amazing. They claim that every member of the one family member, poor or rich, they have diabetes. In India, diabetes is also because of rich people have, just like us, but also poor people have diabetes because they have a lack of nutrition, proper micronutrient, which increases oxidative stress and inflammation. And so in India, in both type of population have increased incidence of diabetes type 2.
We're talking 1/3 of the United States population, and Dr. Prasad, 1/3 of the people on this call
Yes,
said that they were benefited by your product. Imagine if everybody took your product.
exactly.
That would eradicate this condition. Let me just keep my mouth shut and just move on to your next slide. That's just mind-boggling to me.
Yeah. And here, the cost is another mind-boggling.
Mm-hmm.
There is a $327 billion we have spent to treat diabetes. And it's amazing. And if you include the undiagnosed cases, also pre-diabetic situation, gestational is pregnant. During pregnancy, some people develop diabetes, but after the birth of the child, they disappear. So, but still, when you have gestational diabetes, pregnant women need treatment. So the total cost of the diabetes and the pre-diabetic cases and gestational diabetes, $403 billion. You can imagine.
Well,
save.
Well, I'm just going to say a little sidebar on the outside of our conversation right now, that everybody needs to just say to themselves, is there a financial interest in diabetes? $400 billion industry. Is there a financial interest in diabetes?
Yes.
So everybody who's here right now, ask yourself that when you go to the store and you buy yourself some soda or add extra sugar to something, and eat a lot of sugary foods throughout the day, especially processed foods, ask yourself, who is benefiting here? Could it be the $400 billion industry is benefiting at your cost? Keep that one in mind, folks. So that's amazing to me, Dr. Prasad. This is just huge.
It is amazing. And the question is, that there is no preventive strategy recommended except diet and lifestyle changes.
Right.
That
That's the only thing that you get from the
diet. That's all. That's all. There is no other.
Control your diet and exercise properly. That's all that's being told.
It does. But as you said, we have discussed in the past, that human behaviors are difficult to change.
That's right.
And that's why we always suggest take good diet as much as you can, but
Mhm.
that's not sufficient to reduce the causes of diabetes.
Mhm.
Current treatment is treat the symptom of the diabetes. Once you have diabetes, they have nothing to say how to prevent that. And I will tell you all these issues.
Okay. All right. We're looking forward to hearing that. I love this diagram here. You're showing us exactly how glucose is transported into the cells.
Yeah, yeah. What happened that when pancreas releases the insulin, if you ate as soon as you eat the food, glucose level goes high, and it gets sent to signal to pancreas to send some insulin. And when insulin comes, then it goes to insulin receptor that located in the cell, on the surface of the cell. And then receptor gets activated, and then they brings what is called a insulin receptor. You don't have anymore. But anyway, you can see the insulin receptor. When it stimulates the insulin receptors, then glucose transporter number 4 is hanging around in the cytoplasm. So as soon as the receptor gets activated,
I thought we had a picture. I thought I had a picture of that one, Dr. Prasad, but it looks like it's not here. Go ahead.
yeah, so glucose transporter number 4, there are many types, glucose transporter 4 get translocated from the cytoplasm to the cell membrane. And then this says that glucose is hanging around there. He said, oh, now you can come and enter into the cell. Then enter into the cell. Without that, they cannot enter the cell. And once they enter into the cell, they use for energy generation or for other purpose that glucose are used. But so it is very important that your insulin receptor is functional. And what happens in diabetes, oxidative stress, free radicals, will damage the receptor of insulin. So now,
so
yeah,
that's right here. So like if this is the insulin, oxidative stress is almost like this insulin receptor becoming rusty.
yeah,
Almost like it's rusty, so the key can't go in.
can get, and then if you have damaged receptor, they can stimulate it. Then glucose transporter protein, which are lying in the cytoplasm, can be translocated or can be put back in a cell surface membrane so that they can allow glucose to enter inside the cell.
This never goes in. So
if
if this gets
filled.
rusty and the key doesn't fit, the sugar never goes into the cell.
That's right.
Wow.
Cannot, because the glucose transporter, until you bring the glucose transporter protein to the cell surface, glucose entry is blocked. Cannot go inside.
Mm-hmm. Gotcha.
Here is the major things. These are that's amazing, the statistic that diabetic related complications, despite, you have to remember that, even though we are using all these drugs and medications right now, there are 6 different groups of diabetic medication, different class, which work by different mechanism. But despite that, you develop a diabetic-related complication. And you can see one of them is eye problem, which is called retinopathy. Again, this is all the statistic of 2019, 4.1 million people have retinopathy, eye damage.
Wow.
You can see that 37 million people have a kidney problem. Almost all people who have it's amazing how much statistics is there, despite all these medications that we use. Neuropathy, 50% of the people who have the diabetic type 2 or type 1 develop neuropathy. And heart attack and a stroke, 90% of the people who have a diabetes will develop some kind of heart disease and stroke. And food damage is another one. Food damage, if not treated, causes 185,000 per year amputation. And African blacks are 4 times more than white population, maybe because they don't take care of that. I don't know why the reason is, but that's true.
Yeah. Wow.
So it is very disturbing disease. And if you look, not only during your lifetime, quality of life is poor, but development of diabetic-related complication is severe.
This is all big money too. My mom had this problem. My mom had this problem. My mom had this problem.
Yeah,
And
they
she
have
went on
yeah.
to have kidney disease. So this is these are the very things that the intensive care was offering no solutions for my mom. And she died
Because drug
20-some
becomes,
years ago.
what happens that the patient becomes eventually resistant to all drugs.
Mm-hmm.
And then they started giving, say, for example, if you have type 2 diabetes and you become resistant to all 6 classes of drugs,
Mm-hmm.
and then they will allow the injection. But if you have injection of insulin, they will allow it, because generally insulin is given first to type 1 diabetes patients because pancreas is not producing any insulin. But in type 2 diabetes, only time they get insulin when they become resistant to oral medication, that there are 6 different types of trial.
Mm-hmm.
And then if you give insulin, then the risk of hypoglycemia increases in combination with oral drug, and that can cause a stroke, that can cause a terrible if you don't care immediately. And so these are the complicated problem, and we have a program by which you can prevent it, by which you can also improve the efficacy or effectiveness of drug. So you may require 1 or 2 drugs instead of 5, 6 drugs,
Right.
or may not require. I mean, we don't know. And so, but it is a worthwhile try. If you are taking already medication, you try our product in any way. And then when the fasting glucose and A1C improves, doctor will start decreasing the drug requirement.
That's right. That's right. Let's do this, Dr. Prasad. The story that I want to share with you earlier, let me just share that with you now, because especially while we're looking at all these different issues that this causes, and everybody who's on the call, just keep in mind what Dr. Prasad just said, because a lot of times what the dots that we don't connect is the fact that the simple act of glucose entering into the cells, and its lack of ability to enter into the cells, the lack of the cell's ability to use the glucose as fuel, means all that glucose is still in the body, doing damage to organs, leading to all these problems Dr. Prasad just told us about. Now, the story you're going to hear right now is Kareen Evans. She just interrupted our call one night and just told her mom's story. You've heard this before, Dr. Prasad, but there's a lot of folks on this meeting right now that have never heard how Kareen described what happened to her mom. And, it touches home to me because, again, my mom was in the same situation, and there was no solution. Kareen was in a different place because she had a solution. She had that immune system kicker in her available to her, and her mom benefited from it. So I'm going to play this real quick, and then we'll pick right back up in the slides and let you just finish telling us how the micronutrients can make a difference for us, okay? Mm-hmm. Story is it's just amazing. It's amazing. So,
can I talk real quickly? I have to run. Is it all right?
Your name, please?
My name is Kareen.
Okay, Kareen.
All right, so I just have to say it. So I started, I've been pre-diabetic, and I started the entire supplement last Friday, and my blood sugar been running like 115. Now, since I start using it, it's been like 88. Anyway, I'm not even here to talk about me. So my mom, I'm a nurse, and my mom been in a hospital.
Wait, hold on a second, Kareen.
Yes.
You said you started when?
Last Friday. Last Friday. And usually if I run to open my door, I'm out of breath, and I can run half a block without being out of breath right now. But what I need to tell you, what I didn't even tell them in the hospital, my mom is in the hospital. I took her to the hospital Friday morning. Congestive heart failure. She's also diabetic. And she has chronic kidney stage 4. So she has all this fluid on her. They put her in MSICU, and she's been having a lot of problems. I was scared to death as a nurse, thinking I'm going to lose my mom. Difficulty breathing, her lungs filled with fluid and all that. Anyway, I said, I want to try it. I want to try it on her. But then I'm like, oh my God, should I not? So I went to the hospital and I mixed 4 capsules of the Micro Daily in the applesauce and I gave it to her yesterday morning. Now she wasn't peeing. They're thinking diabetes. They're thinking dialysis because her kidney functions are way, way off. I'm like, oh my God, I can't give her dialysis. Now, I kid you not, within 5 hours of me giving that to my mom, now they had put a Foley in her because they want to see if the urine output was coming. They're like, we don't see urine, maybe she's retaining. Now, within 5 hours, that urine, that bag had 800 liters of urine in it. I kid you not. Now, I wanted then, her hemoglobin was a bit low. So the nurse said, is she anemic? Yeah, she is. So they said, then they kind of tugged the Foley a little bit. So there was a little bit of blood. So they did a hemoglobin to see what her blood count was. Now, with the bleeding, her blood count should be lower. Her blood count went up by 2 points. 2 points. I kid you not. Then, my mom, she's been sleeping ever since I put her in the hospital, sleeping. She would open her eyes and go right back into a deep sleep. When I went back to her yesterday, she was up singing. All last night, she was peeing like rain. All right, in the Foley catheter. I went back this morning because she's in MSICU now, and they're saying, hey, they're asking me, is she full code? Yes, she's full code. All right. I went back this morning and I gave her another dose. The cardiologist, they called me and they said she might go home Tuesday. So the nurse, they did a urine culture. They were like, oh, we gave her some antibiotic just to make sure. But she just turned around, a full U-turn back to okay. So we think it's a dose of antibiotic that did it. But I did not tell them what I did because I wasn't supposed to do it. And I'm a nurse and I work at that hospital. So I couldn't tell them. But oh my God, I just had to say it. I am driving now to go give her another dose. And I just had to say it because I tried it so I could introduce it to my patients. But when I see what it did to my mom that I thought I was going to lose, I'm like, oh my God. So
Karen,
that's my
wonderful.
story. I don't even want to talk about me right now. I'll talk about me another time. But this just helped my mom. Her kidney function, her BUN and creatinine started going up to the normal level. It's not there yet. It's going up, going in the right direction. Her blood glucose, because when they check it, it was 244. When they check it, it was 118 again. Oh my God.
How old is your mom, Karen?
87.
Wow.
My age.
87. And now, nice clear urine coming out. That wasn't coming before. They were setting up dialysis for her. The doctors is like, oh my God, okay, she's doing very well. We don't know. The nurse is thinking it's the antibiotic. It was not the antibiotic.
Antibiotic is amazing. Yeah, just amazing.
It was the Micro Daily that did it.
Which formula did you give your mom? EMF or original?
Yeah, the red label.
And you gave her four.
I gave her 4. Yes.
Karen, your story will undoubtedly help a lot of people because.
Oh my God, I am a nurse. I'm almost a nurse practitioner, and I was a bit hesitant to give it to her, but I'm like, you know what? They're telling me my mom is doing very bad. I'm just gonna take my chances. Oh my God, my mom sang a whole hymn this evening to me.
Wow. Who sponsored you, Karen? Who introduced you to you?
Andrea Fine and Carlos Alvarez.
Okay. That's wonderful. Carlos Alvarez is going to influence a large number of people. So thank you very much for sharing the story. And we would appreciate it if you would come back next Sunday when we have Dr. Prasad on. Would you please come back and be prepared to tell your story?
I will. And my mom should be home and I'll let her talk.
Please do. All right. That's going to be very important.
Well, Dr.
Okay, because Dr. Prasad is going to just, he's going to be blown away. He's not going to believe it. Okay. We need
Oh
we
my
need to blow
God.
him
I
up.
didn't, I mean, I knew what it was doing for me, but I was a bit, especially with her age, and she has a lot of stuff going on, congestive heart failure, diabetes, hypertension. She had a heart attack before, she had a stroke before, a whole lot. And oh my God. Oh, okay. I just had to say that.
No, we're glad
I
that
just
you
had to.
we're glad you felt like you had to say that. Thank you. So, Dr. Prasad, that kind of falls right in line with what you just told us.
Yeah. And I think, my current approach had improved further. For example, micronutrient EMF is, of course, you can see that by itself has a lot of benefit. But one thing that I don't know whether she was taking or not, but she should, if not taking, is the probiotics. Those two are extremely important. And the third thing that for diabetes, omega-3 fatty acid is general health, not necessarily for diabetes. But the one which is very important for diabetes is a probiotics, of course, EMF, and also collagen peptides.
Right.
You know why? And actually, I have a paper which is will be extracted. They wanted some revision exactly on this issue, and the reason collagen peptide is first. The reason the probiotic is important because the severity of diabetes is correlated with the severity of intestinal dysbiosis. In other words, how severe your number of harmful bacteria increase in your gut. So this is very important to take care of that. And the collagen peptide has been done a placebo-controlled trial in a diabetes patient type 2 who were already on medication. Here's the data. You can see that this is a double-blind placebo-controlled trial, and that's why I believe that we have to have a multiple approach to improve perfectly diabetes, even in the treatment of diabetes or prevention. You can see that fasting glucose in drug groups who were taking a 3-4 different kind of drug was 125 milligram, which is level of almost pre-diabetic. But this is better than if you have over 200.
Right.
And then if you gave a collagen peptides plus drug group together, then it drops to 105, which is normal range. Now, A1C in a drug group was 6, which is good.
Right.
But with collagen peptide, it dropped out to normal level 5. Insulin resistance decreased from 6 to 5. So you can see that collagen peptide by itself has, in combination with drug, is very important. But by itself is also important in prevention, because what it does in a pancreas, secretion of insulin goes on very nicely. But something happens that the enzyme called incretin, INCRETI, incretin enzymes get elevated. When that gets elevated, they reduces the secretion. That's the enzyme DPP4. This is the enzyme. It reduces the production and secretion of the enzymes. And so this enzyme becomes elevated, and they block the secretion of the insulin from the pancreas to the blood. So what collagen peptide does is it inhibits the enzyme, and therefore now secretion of insulin can be restored to a normal level. So now your blood will have enough secretion. So, and as a matter of fact, the collagen peptide inhibits the activity of DPP4, and it is not toxic. There's a prescription drug which does exactly the same thing, namely inhibits this enzyme which prevents the secretion of insulin from pancreas to the blood, but they have a toxic effect.
It's got
collagen peptide has no. So that's three things for is in my paper. As soon Jonathan gets out, I will send you a copy.
Yeah, we're gonna have to go through that.
Yeah, it is very important. Omega-3 is extremely important, especially for brain, but also your overall health, your immune function, which is very important. And you can see that omega-3 daily is important thing. There is a DHA. The three component constitute omega-3: DHA, EPA, and ALA. And ALA comes from vegetarian diet, but their conversion rate to DHA is extremely slow, very slow. They estimated only 1% of ALAs get converted to DHA. So on your brain, 40% of fatty acid that we have in our brain has 40% of DHA is present in our nerve cell in our brain. 40% of the fatty acid in the brain is DHA. So that means brain needs more DHA, right? And that's why in our formulation, we have given a ratio of 2:1, two times more DHA than EPA. And then we also have the ALA, a certain amount from flaxseed is very rich in ALA, because ALA by itself has certain function, especially with respect to heart disease, beneficial on heart disease. And so we added ALA. And gamma linolenic acid or GLA it depends upon it is a smaller amount, then it acts as a anti-inflammation. If it is a high amount, then it acts as a pro-inflammation. Then one time someone of you asked that if we are taking so much from the diet, why I will need the extra GLA or gamma linolenic acid? Why I will need it? Because we have given 30 milligrams. Well, the answer is that from the diet you take about 11 to 20 grams of DHA. I mean, the gamma linolenic acid or GLA, you take that much. So adding it 30 milligram is not going with significant difference.
Right.
Still, the important thing for this formulation is GLA was added just to looks like that we have considered that issue, that a small amount of. So if somebody challenges it, you didn't give anything GLA. Well, we can say that we have a small amount of GLA, but as far as this function in terms of an anti-inflammation effect is not there, because at least this formulation would say that we have given you GLA, small amount of dose that acts as an anti-inflammation.
Right.
But if you are from the diet, if you are taking so much GLA, but at least we can say that our formulation has a small amount. It is a kind of a defensive state that a small amount of GLA, we know, we consider it. And I also know from the diet, you take 10 times more. But the important thing for this formulation is that we have an EPA and high amount of DHA, so that brain can have sufficient amount of DHA to perform its daily function.
I like that you added this also, the borage oil, because that's been really good for circulation in diabetic neuropathy.
Yeah, because the borage oil also have a lot of ALA. They have a lot of ALA.
Mm-hmm.
Okay, we're going to break in right there. Dr. Prasad truly presented the facts. That was kind of amazing. If you know someone who needed to hear this presentation, just have no worries. It has all been live streamed, so it's available for anyone to be able to access it. Just get back with the person who invited you here, and you can find the recording. It's out on my YouTube channel, YouTubeJonathan.com. YouTube.com/Jonathan Jones. You can also find it there. YouTube.com/Jonathan Jones. You can get the recording there. But as you can see, Dr. Prasad covering his paper, and remember, this is his paper again. Here it is. So you can find this published paper in the Journal of Nutrition and Food Sciences. The exact title: Prevention and Improved Treatment of Diabetes Using Micronutrient mixture, probiotics, omega-3, and collagen peptides, a published scientific paper by Dr. Prasad on this very subject. He just explained how and why his hypothesis works, and a double-blind placebo study showing the benefits of collagen peptide and how it behaves just like a pharmaceutical drug when it comes to this mechanism of DPP4 or whatever he said that was, kind of out there with that particular enzyme. So just outstanding presentation. So Dr. Prasad's concluding remarks: microdaily EMF in combination with probiotics and prebiotics could be useful in the prevention of diabetes type 2. Microdaily EMF in combination with collagen peptides and probiotics with prebiotics and omega-3 daily could improve the effectiveness of drugs in reducing the progression of diabetes and diabetic-related complications in diabetes type 2. So that's directly from the professor himself, Dr. Kedar M. Prasad. Just exciting, and I love hearing it. I love hearing the stories. Kareen's mom, Miss Olive, that was just absolutely amazing. It was exciting, amazing, and for me a little bit depressing because it reminds me of exactly what the hospital didn't have when my mom was in the intensive care and dying under the same exact circumstances. So if you as the microdaily EMF is the formula that Dr. Prasad recommends the most. You can find it in each one of these bundles right here. These bundles are the Core 4 is the one that has everything that Dr. Prasad recommend in that paper. So that published paper talks about the benefits of the Core 4. It didn't say Core 4, but that's what the entire bundle is with respect to diabetes. Everything there. He didn't talk about omega-3. We'll maybe share this when we do part 2 of our program in 2 weeks. In part 2 of the program in 2 weeks, Dr. Prasad covers how the omega-3, you remember that key that unlocked the insulin receptor in the cell, which then allowed that AT4 or whatever it was called to allow for the glucose to enter into the cell? Remember that key? He said omega-3, we'll share that with you. And hopefully he's here live. He'll share that with you. To omega-3 unlocks the cell to allow glucose to go in independent of insulin. That Core 4 bundle is a diabetic's dream. That's all I can tell you from there, based on scientific evidence. That's the microdaily. The microdaily, by the way, the basic amount that you would take is 3 capsules twice a day. 3 capsules twice a day. The probiotic has 30 capsules. Just take 1 a day. And you can get that bundle by itself at $410 if you just want that. Then the collagen, of course, comes with the premium bundle if you just want that. And then the omega-3, if you add that on, you just take 1 of those per day. And let me just go back to the collagen peptide. You take 2/3 of a scoop once a day. That's all you have to take of the collagen peptide to get the benefits that Dr. Prasad was talking about there. All of this is in the Core 4. Engage Global also makes a digestive boost. It makes a CBD boost for those who have anxiety issues and want to sleep better. The brain boost is still one of my favorite, second only to microdaily itself, because of the boost to brain activity. I just absolutely love that brain boost. I won't do without that. Sleep boost, that will definitely help you get deeper, better sleep. We'll have a whole discussion on that at some point. But again, here we're talking about during Diabetes Awareness Month. The Core 4 is the one that we really highly recommend in this case. If you were to buy each of those individually, the retail cost would be over $300. If you bought them as one of us, a distributor, the cost would be about $250. But because you're signing up for a subscription as a preferred customer and you buy it as a bundle with the Core 4, the cost is less than $200. There may have been a slight price increase right now, so it might be about $205, somewhere in that area, plus $10 shipping or whatever the taxes are in your state. So for approximately $200, you're getting the entire bundle of the Core 4, which is a significant savings. So again, there's a picture of all the bundles themselves. You just get back with the person, whoever invited you, and they will help you to make a decision about which package, which combination is best for you. They can guide you on the prices and everything else. We have one or two questions, but before we transition to maybe taking one question or two, this is a screenshot of the calendar of events for this coming month. So if you want to take a screenshot of that, you can, or someone can email it to you if you're here for the first time and you're wondering if there will be additional events. On November the 17th, we'll do part 2 of Diabetes Awareness Month. So you want to mark that down on your calendar. And then at the last week of the month will be a question answer session with Dr. Prasad, and Bernardine will be hosting that session. That's on November the 24th. So we can look forward to that. But next week, we have the ambassador of the company, Jeff Ashby. He will be covering the theme, Everyone Has a Story. So you'll get a chance to hear, oh my goodness, if you've never heard Jeff do a presentation, giving us so much of the history of the company, where those products that Dr. Prasad has formulated, where it came from, how it is that we have this amazing access to some amazing formulas by this man. You make sure you want to be there for that. But even besides all that, you think Kareen's story was amazing with her mom, Ms. Olive, then you're in for something for next week. And if you've got testimonials that you would like to share, make sure you let us know about it. And you can do tell your story for next week. So we can look forward to that. Okay. So that's exciting for next week. So next week, Jeff Ashby, Everyone Has a Story. The week after that, we're doing part 2 of Diabetes Awareness Month. And then after that, we get Bernardine and Dr. Prasad with answering your questions. So one question came in was about a client that was told by her doctor that she has to go on dialysis. And because, according to the doctor, there's chromium in microdaily, she should not take microdaily. We'll get a comment from Dr. Prasad on that question, Deborah. We will trace that down, and that would be just really to satisfy the doctor and present an argument. But generally speaking, when a doctor is giving a reason for not using Dr. Prasad's formulas, it's just because they simply don't understand it. So it's, generally speaking, a lack of knowledge on their part that causes them to push back that way. But you might want to give the doctor a copy of Dr. Prasad's published paper. Let the doctor read that, because he has clear evidence that presented right there as to the benefits of microdaily with someone who is dealing with kidney issues. And I think all of us have had clients with kidney problems. My sister was in stage 4 kidney disease, and now her kidneys are as good as mine. She no longer has the problem. Brittle diabetic, and she wakes up and her fasting sugar levels are normal. So the benefits to someone in that situation is extensive and undeniable. So go ahead, Deborah, please.
That's what I was thinking also. And the sad thing about that particular individual is when she went back, she had stopped taking it for some time ago because she forgot. But when she went back to the doctor, she had gotten back on it because we had gone to a getaway, and she's like, I'm going to get back on it. She got back on it. When she went to her doctor, her glomerular filtration rate had improved since she was on the product. But the doctor still said, oh, because it has chromium in it, you need to stop taking it. And she stopped taking it.
Wow.
She stopped taking the microdaily. So I said I would check with doctor, because she said, I looked it up and all the literature said anybody on kidney failure doesn't supposed to be taking chromium. I'm like, maybe it was synthetic chromium they were talking about, maybe not the organic, but that was crazy. She had evidence that her kidneys had improved, and they still told her to stop taking it.
Yeah, that's sad. I'm one of my spiritual mothers. Her blood pressure improved tremendously on microdaily. Her doctor said, stop taking it. And her blood pressure was in the 200 over, like 130, that range. and had been that way for about a year. She was stroke level, heart attack level. And Michael Daly, in just less than 2 weeks, her blood pressure was shooting down to normal. Went to talk to the doctor. The doctor said, no, this is interfering with my treatment. She literally handed me the product back. And 6 months later, she was on dialysis. And a year after that, she was dead. So Dr. Prasad, when I told him that, Dr. Prasad said that his quote, he said, "That's criminal," is what he said. So that's all about that.
It's sad.
Yeah, it is. One last comment here. Elizabeth, go ahead, please.
I just wanted to say I got a call last night from a customer wanting me to send all of this information to a friend of his. He had really bad kidney function. After 2 months of them taking the microdaily, his doctor told him that his kidney function was normal. So he wanted to share this information with a friend.
That's called dropping the mic right there. Thank you very much, Elizabeth. And thank you all very much for joining us. And, that's exciting to hear. Look forward to seeing you guys again next week with Jeff Ashby.
Let's go!
Thank you, Jonathan. That was good, Jonathan.
Thank you.
Thank you.
Awesome
Wonderful.
sauce.
Thank you guys very much.
I enjoyed it. Thank you so much.
Stop
Wonderful.
on learn tomorrow, you guys.
Good meeting.
Awesome.
Wonderful.
Awesome.
Bye, good night.